Good afternoon to all of our colleagues. Thank you so much for being here with us today. And we have decided to do this digital event, no matter where we are, at home or at the office. We will have the opportunity to learn some truths about the coronavirus, COVID-19, not like the truths that we read on mass media, but the way they are truly proven by specialists. So, today we have Dr. Panagiotis Gargalianos with us, and the director of the pathology clinic at the Medical Center of Athens, and also the president of the committee of the fight against coronavirus here in Greece, and also Dr. Giouli Argirakopoulou, who is a PhD at the University of Athens, and also the director of the diabetes unit at the Medical Center of Athens. Thank you for being with us today. And the floor is yours. I think, Mr. Gargalianos, we're going to start with you, and thank you so much. Thank you for your introduction. I'm very happy to be here with you among active citizens, because the thing that counts the most is the capability that we have to communicate with the citizens of our country and also debunk the myths that we can. I'm trying to activate my share screen right now.
Disable participant screen sharing.
We need some assistance regarding the share screen feature.
Disable.
It is disabled, apparently. Maybe Ms. Giouli would like to start, Mrs. Argirakopoulou, if she can use her share screen. Oh, I cannot do it either. It is disabled. So give us a minute. Just a couple of minutes, please. Let me also thank you for this invite. I was very pleased to be here with you today. Mr. Gargalianos is an expert regarding the COVID-19 disease. He's the most appropriate person. He's a very balanced person, so he will present the truth as is. And then I will give you some tips about senior citizens and more vulnerable people. So it's COVID-19, and the virus is SARS-CoV-2. When we're talking about COVID-19, we're talking about the disease, let's say. And I'm going to talk about obesity and the relation that it has, not only because obesity is my hobby, is what I like to do, but a very big number of obese people do not know that they are vulnerable people, and in reality that they should protect themselves even more. Can we try this, Mr. Gargalianos, the share screen? I think it's okay now. Well, let's start. As I said before, Mrs. Argirakopoulou and I will try to give you some information regarding COVID-19, some useful tips, and also solve some of your questions. Ladies and gentlemen, we're talking about a pandemic with 67,564,000 people until this morning, and over 1.5 million deaths. You can see the red dots as they are hugging, let's say, the entire planet. What about our country? We're not talking about Greece, we're talking about Europe. You can see this red color. Here we are at the bottom. Europe, apart from the northern countries, has a positivity of more than 4%, which is the limit. And this is how the alert, let's say, is rung, the bell of danger. So the entire continent is red, as you see, Great Britain, the United Kingdom, and of course Sweden. And let's look at some data, because we need to check our data. Where are we now? When we're analyzing the numbers, and we're saying that today we had this number of deaths, the most important thing are the 2-week spread. How many positive cases we had, how many deaths we had. And while Greece was the best example, let's say, a worldwide example during the first wave, during the second wave we are having problems, because right now we have 222.4 cases, confirmed cases, per 100,000 people. Well, of course, we're not like Croatia, as you see, it's even more, or Slovakia, maybe even Germany, or the United Kingdom, or Italy. But in death numbers, it's 12.8 per 100,000 people. It's not a small number. It's not, of course, like Bulgaria, not Austria, not the Czech Republic, but as you can see, the United Kingdom has way less deaths than us, and also France. Until yesterday afternoon, yesterday evening, 116,722 cases have been recorded, and you see the map, the red color, which shows the number of cases. Now, regarding the ages and the sexes, I have underlined here in red something that I would like to talk about with you. Now, from the age group of 40 to 64 years old, we have 41% of the total of the cases, but 14.1 deaths. This is the most important thing, and 43.5 people are at the hospital right now. So I think that only children below the age of 12 are relatively safe. In Greece, there is no huge discrepancy between men and women regarding the cases. And let's take a look at our country right now. Over 100,000 cases. Greece here, as you see, from central Greece to Thessaly and up to Thessaloniki, and Macedonia and Thrace as well. We can see that this is a huge problem, and Athens is also red, of course. In Athens, we can analyze it by area, but as a regional unity, the entire unity is red. As you see, Peloponnese and Crete are relatively better. I hope they remain like that. And of course, this does not change if we take a look at the last 14 days. It's the same picture. And what is also worrying is that the Achaia region is becoming more orange. And I am going to say that's crystal clear. At any given time, any area, any region can turn red. So the decisions that are being taken by the government are for general measures that will be applied all over the country and not just in separate regions. Now, the cases from March and the deaths with the purple color, and this is, of course, the huge problem that we are facing in our country and the measures that we need to take, which are not, of course, easy. Also, many things have been told about testing. I don't have any graphs right now, but we are testing more than the average of Europe, especially during the second wave. And why? Because at the first wave we didn't have any tests, and right now there's a lot of people being tested. And what are the test methods that we have? We have the RT-PCR classic method. We have the antigen and the antibody tests. Now, let's take a look at the things a bit more focused. This RNA virus, let's say the cousin of the coronavirus that does the common cold, has this spike protein and also other structural ingredients, but this spike is the most important thing because it's the spike that gets attached in specific receptors of human cells, not just at the respiratory system, but this is where it enters the human body, but also other parts of the body as well, where it can find these receptors. But let's say that we will deal with the respiratory systems right now. Are tests serious? Are tests important? The PCR test is the cornerstone, let's say, the gold standard. And of course, it can trace positive cases and negative cases in a huge percentage, more than 95%. Of course, only if it's done in the correct way, but I'm sure it's done in the correct way. The antigen test, which is a diagnostic test that has come out right now and has been used a lot all over the world, can lose, let's say, some positive tests and turn them out as negative because it is not very fast. It delays a bit. So if someone comes from abroad, we will give him a PCR molecular test, not an antigen test. It is fast, like I said. You can take your answer in 15 minutes, and it's also cheap. It can be repeated every 2-3 days if you want. We here at our medical center, we do these tests every 5 to 7 days. So I don't think that we will lose any of the cases. Now, the antibody test, which can be found in pharmacist shops as well, they have no value whatsoever. The only value they have is for serology tests and for reasons of measuring the number of cases. Why is that? Because antibodies can be found after 14 days. And what if we are positive? What if we test positive? This is the graph of the CDC. We stay at home, of course. Mrs. Argirakopoulou also will give us tips on good food, good hydration. And we are separating ourselves from other people in order not to infect them as well. And, of course, we communicate with our doctor. And the doctor, of course, will ask you to monitor your symptoms and also measure the oxygen in your blood. What are the symptoms of COVID-19? They will start appearing after 2 to 14 days after you have been exposed to the virus. This is why we need to keep the quarantine for 14 days. The medium is 5 to 6 days. There's lack of smell, lack of taste, fatigue, cough, chest pain, sore throat, difficulty breathing, nausea or even diarrhea. The most important thing, ladies and gentlemen, is that sometimes symptoms can remain for a long time because this virus affects all the organs of the body, from the brain to the heart, the lungs, the liver, the intestines, everywhere. And it might also cause thrombosis in the heart. It affects the blood. And also, some people do not know enough information. This COVID-19 is something very new, so we do not know the long-term effects that it might have. So how can we separate between the common cold and the COVID-19? We know that the flu starts right away, but the common cold starts with the sniffles, let's say, while COVID-19, we do not know. It might start fast, it might start slow. Fever is a common phenomenon in COVID-19, while in the common cold and the flu, the common cold, no, the flu, yes. Chills, they do not happen often in COVID-19. Pain in the muscles happens sometimes in COVID-19. Headache is rare in the common cold, common in the flu. Sometimes it happens in COVID-19. Sneezing is very common in the common cold, while in the flu and COVID-19, not so much. Sore throat is common in the common cold, more rare in COVID-19. And what I would like to underline is the loss of smell and taste. We know it happens sometimes in the common cold, but we also know that our nose is stuffed. While in COVID-19, it happens often and all of a sudden without having a stuffed nose. Coughing is also common, and dry cough as well. Sometimes diarrhea, and that's it. Now, the other thing I would like to underline is the drugs. You have read yourselves, you have seen this on TV. I believe that doctors cannot become journalists, but anyway, many of my colleagues went on TV and talked about remdesivir. This drug was first launched for the Ebola virus. It was a failure, actually. But theoretically, it is successful in COVID, but this is not a solution. Another drug is the favipiravir, and it is given in people in hospitals. It circulates in Japan right now. It was a failed drug against the flu, well, partial success, let's say. And it can be found in some countries for a drug against COVID, but without great results. So we have two drugs. One can be found in the hospital, one over the counter, which do not have great results, and they are still being studied. But it is used because there is nothing else we can do. So it was really pleasant, let's say, that it received an emergency use authorization from the FDA. The drug bavlanivimab. So if a patient has underlying conditions, so has a huge danger of catching the COVID, you give him this drug which has ready antigens, antibodies. This is the one President Trump used, which are well known right now for that. Our Archbishop did not use these drugs. So, and the other one, the RegenCov2, is a cocktail of two antibodies that are trying to stop this hooking, let's say, of the spike on the protein. These are very promising, and it's huge importance, even if it costs 1,000 euros each. If you give it to someone and he won't even go to the hospital, and of course we cannot count the cost of life in money, but even financially, the fact that he will not go to the hospital is more financially stable for the country. Now, the vaccine. There's been a huge effort all over the world. In phase 1, the initial phase, we had 41 vaccines. Phase 2, we had 17. Phase 3, we had 13. Only 7 are expecting for their approval, and so far none of them has been approved, but tomorrow FDA will approve the Pfizer vaccine. It has already been approved by the UK, and the vaccination has begun this morning. EMA, we are expecting at December 29. Now, what's the philosophy of this vaccine? To create antibodies, to produce antibodies and inject them in the human body, as vaccines tend to do, in order for the organism to produce antibodies. And this is why, this is how our body can react. I'm not going to read you all of this, but I would like you to see that there are many types of vaccines. The mRNA vaccines, maybe these viruses are innocent, let's say, so we use them in this vaccine, the RNA vaccine, in order for it to transport the antibodies to our bodies. We have different ones with proteins, etc., etc. Now, what are the different kinds of vaccines here? We have the RNA vaccines, the DNA vaccine, but these do not exist widely right now. And also we have the viral vectors vaccines. And also we're waiting virus-like particles and also subunit protein vaccines, which I think will be ready in 2021. And I'm guessing that in the summertime of 2021 we will have about 15 vaccines ready. This is a huge breath of relief. So we are wondering, this mRNA vaccine, this is the first that is circulating, it only stays in your body for a few hours, so it cannot be incorporated in the DNA of the human body. So it cannot do all these troll things that we are seeing on the internet. What does it include? It has these specific chemical, let's say, instruments inside, which can be found in many other food products, in other products that we have in our fridge and we use every day. So let's say cheese and drinks and sports drinks, or products of meat, or salt. So these vaccines, the things that they have inside, can be used by vegans and vegetarians as well. So as the D-Day, as we call the D-Day, the day the disembarkment in Normandy happened, we have the V-Day today, the vaccination day. And I'm hoping that in January we will be ready to start vaccinations in our country. It will not be obligatory. It's a matter of human existence. Me personally, in order to answer your questions, I will be vaccinated. Thank you for your attention. Thank you very much, Mr. Gargalianos. Thank you for informing us that the vaccine will get approval from FDA tomorrow. And before I give the floor to Mrs. Argirakopoulou, I can remind you all that you can use the YouTube chat in order to ask questions. Mrs. Argirakopoulou, the floor is yours. Give me a minute, please. You can find it at the bottom of the screen. Is it okay? Can you see the screen? Yes, we can. And after this interesting speech of Mr. Gargalianos, you gave us all the important information regarding the vaccine, the cure, the symptoms, and I will specifically talk about vulnerable groups of people, and I will give you some advice on nutrition and exercise. As we know, more than 80% of the people will have an underlying condition. 20% of them might need hospitalization, and 5 to 17% of them will need to go to the ICU. So it is important to understand that all of us are vulnerable. We are all vulnerable, people of all ages. But some people have underlying diseases, and they are facing a greater danger to catch COVID-19. And what do we mean by that? People that need to go to the hospital, need to go to the intensive care unit, people that need to be intubated, or even people who will die, of course. Now, more specifically, there are some things that are connected with a high risk of COVID-19 disease. People that have malignancies, cancer, people who have liver diseases and respiratory diseases or heart diseases. So, kidneys, lungs, and the heart. Heart failure maybe, people who have had a heart attack or have been have passed some surgery in the heart. Another great category are people that are immunosuppressed, people that have had a transplant of an organ, let's say, of bone marrow also, and people who have autoimmune diseases, rheumatological diseases, etc. Obese patients, and I will talk about that later on. People that have diabetes of all types, pregnant women also are high risk, male, people of older ages, and also the healthcare professionals. These are all high-risk people because they come in touch with people who are sick. Now, before I move forward to the next slide, people that have all these diseases should get in touch with the therapist, with the doctor, in order to get more information or more guidelines in order to protect themselves. But in total and in general, all these directions are common for all people, whether they are in a vulnerable group or not. What Mr. Gargalianos said before, for example, social distancing, wearing masks, antiseptics, washing our hands, we should all do that. So I will not talk about all those categories because I will repeat, if you have some of these diseases, you should get in touch with your doctor, just in case you need some extra guidelines, let's say. And also, people that are obese do not usually believe that they are in high risk. They do not feel vulnerable, and it is good to remind to all of you that obesity is a disease. So, obesity is a pandemic of the last 30 years, at least, is in collision right now with the new pandemic, COVID-19. We know that obesity has been on the rise in the last 30 years. It has doubled its numbers. You can see the charts here. From 1975, at first there were 15 million in men, and right now it's almost 300 million, but also in women. How is obesity defined? An obese person is a person that has extra fat tissue, and it can be defined by the body mass index. So if your body mass index is over 30, we consider the patient as obese. And of course, there are types of obesity, 1, 2, and 3. And over 40 is morbid obesity, with people who are very vulnerable in every disease. So if we take a look at your body mass index, a patient who is 105 kilos and his height is 1.79 meters, you use this specific mathematical formula in order to find the body mass index. Why are we talking about obesity right now? Because it seems that this epidemic it becomes even more hard, even more difficult with the COVID-19 because the quarantine and staying at home make it easier for people to become even more obese, to increase their weight, because we cannot exercise, we cannot easily go to the supermarket and buy healthy food. So it's like an endless loop. There are many things wrong with obesity. I'm not going to analyze everything right now, but I want to underline thrombosis and lung diseases. People who are obese already have it easier, let's say, to have a thrombosis. So along with COVID-19, it becomes even more difficult. Just being obese can reduce your life by at least 50%. It is really rare for a person that has a body mass index over 40 to reach the age of 50. So, in contradiction with COVID-19, things become even more difficult. It also makes it easier for the obese person to need to go to the hospital and even to go to the ICU, the intensive care unit. But unfortunately, also, it is much easier for an obese person to die of COVID-19. It has 46% more chances of dying of COVID-19. And over 113% is the percentage of the obese person that needs to go to the hospital. And also the danger of going to the ICU is over 66%. The danger of death is over 48%. And what are those mechanisms, let's say, that lead to this ending? Obese people have it difficult. It's more difficult for them to respond anasologically to the virus, because their T cells that create the immunity find it more difficult to respond. They also have underlying conditions like heart conditions or diabetes, like I said, are high-risk factors for COVID-19. As Mr. Gargalianos said, he talked about the period of being asymptomatic, and after this period the symptoms begin, and there's also a third stadium in which we need to be extra careful because the fever is very high, people have dyspnea, and also can develop pneumonia. And what does it mean? What does it happen? What does happen during this time period? The body creates a plethora of cells in an effort to fight this infection, fight COVID-19, but sometimes this overproduction can be lethal, can be very bad because it leads to this shutdown of organs, multi-organ failure. In order to connect all this with obesity, people with obesity have this type of phenomenon happening in their body all the time. And in order to increase all those cells, in order to fight the disease, to fight the COVID-19, it is even more difficult for them to do so. In this diagram, we can see how the lung cell is infected. Like we said, one infected host cell can create hundreds of new variants, and in that way the infection progresses even more rapidly. The RNA is connected to the receptor, the virus is going inside the cell, and then also moves forward to the remaining cells, to the other cells. And people that are obese, as we know, have increased receptors in their lungs. And what are these receptors? The receptors. It's the goal of the virus, let's say. This is where it goes to get attached, like we explained before. So they have greater risk of becoming ill. These receptors also exist in the cells of the fat tissue. So other mechanisms that can be found is that obese people have difficulty breathing. They have sleep apnea, they do not breathe well during the night or even during the day, because we can understand that if the fat tissue in the belly or over the lungs is very heavy, of course the lungs cannot easily expand to receive the oxygen. And also obese people have high risk of thrombosis, which is one of the reasons of death of those people. And let's talk about something more optimistic. What can we do to protect ourselves? We're going to talk about the 4 pillars of health: sleep, well-being, nutrition, and movement. Sleep well, have well-being in our life, have a proper nutrition, and move our bodies. Now, I'm not going to talk about details regarding sleep, but you can find many good guidelines in sleepfoundation.org. And these are also good for people who are spending a lot of time in front of screens. It also affects the quality of sleep. And the quality of sleep is, of course, attached with the health of the body. Exercise. We have to be active during the quarantine, of course. And every type of movement, every type of exercise is better than nothing. You do not need to exercise for 2 hours a day. Even if you move a bit is better than sitting on the couch all day. And the minimum suggested time is 150 minutes of cardio per week. And also muscle exercises, abdomen exercises, in order to improve your muscle mass. There is no limit in exercising. You can exercise as much as you want. If you want to work out more, it's even better, of course. But this is more important to be prepared. Do not sit down a lot. Be aware to get up every 20 minutes and walk around for 3 or 5 minutes, to stretch a bit, to do an activity, and also have a daily routine by yourself or with your family. Other alternative advice: meditation or at home. What should we eat? We should eat a balanced diet. What does this mean? Fruit, vegetables, of course, during the day. We need to avoid snacking, because it is translated into comfort eating and cravings. We tend to snack, and we tend to eat more carbs when we are feeling low, because they tend to reduce our stress. It has to do with serotonin, it is true, so it tends to reduce our stress, but we should avoid that. People who are at home right now, we are quarantined, it is easy for us to go to the fridge and snack all day long. While we're at work, of course, we cannot leave our desk anytime we want to go snack. It is easier for us, it is better for us to program our snacks twice a day, in the morning and in the afternoon. Of course, avoid smoking and avoid alcohol. And I would say that citrus fruits are very good, green vegetables, dry nuts, dairy, and fruit. And also let me give you a couple of tips right now about antioxidants and vitamins. Should we take vitamins or not? We are not sure, of course, about everything. It is good to protect ourselves. It is good to get your vitamins from your food and from your nutrition. Carrots, green leafy vegetables, red peppers, oranges, strawberries, broccoli, lemons. Vitamin E can be found in dry nuts, seeds, spinach, and broccoli. Vitamin D can be found in fish. It is also created by, of course, the sun, but when we are stuck at home all day, we cannot see the sun. So vitamin D is getting lower and lower in your body. And it can also affect respiratory diseases. We should, therefore, consume fish, liver, egg yolks, milk and yogurt that are enriched in vitamin D. And also oysters, poultry, red meat. It's difficult, of course, to have a lot of these things in your fridge, but just keep the Mediterranean diet standard. We know that in Greece we have olive oil, we have fresh fruit and vegetables, we have legumes, fish, and a small amount of wine, and avoid red meat. And also let me remind you the symptoms of COVID-19. It's fever, cough, tiredness, anorexia, myalgias, and diarrhea. The serious symptoms start about 1 week after the start of low symptoms. The most important thing is the high fever. You should be aware of high fever and come in touch with your doctor, or even go to the hospital. Difficulty breathing is the most common symptom of a severe disease. Do not leave it outside. Be very serious when it comes to shortness of breath and difficulty breathing. And also you should be aware that this disease can evolve very, very fast. It's very serious and it can come from one day to the next, mostly from the 7th day. Let me show you this, even though Mr. Gargalianos asked me not to, but this is a CT scan to show you what we see. This is a normal CT scan. Let's say that the patient is cut in the middle. So I see a normal lung, and this is the heart. These white thingies here are the vessels, the blood vessels. This is how the lung should be. See here, all these white spots, and even if the disease is even worse, we have a pulmonary disease right now. The air cannot get inside the lungs. And we have this upward course right now, but I'm hoping that we will all help each other with the vaccine, of course, to lower the numbers and be able to go outside again, to go to a concert, hug each other, and go to the gym. And thank you for me. Thank you very much. I think that you covered many important things, many important aspects that we had never listened to, especially regarding the obesity, which we talked about. I have a question here from one of our colleagues. Given that the holidays are fast approaching right now, what would you suggest that we should consume? Mrs. Argirakopoulou, please exit share screen. Okay. What would you recommend doing during these days regarding sugar intake and alcohol intake, of course, in order to keep our body healthy? Let me tell you that sugar is very harmful. Of course, you know that. You don't need me telling you that. And during the holiday season, I will give you this advice. Make a schedule. I will eat a lot on the 24th, on the 25th, or on the 31st. And even in these 2 days, focus on protein. When we have a huge assortment of foods, we tend to eat more. So the simple instruction is to eat slowly, to chew your food and eat slowly. The slower you eat, the faster you feel full. The faster you cessate your hunger. You can have sweets, even if they are full of sugar, but without the icing sugar on top. And if you go to someone else's house to eat food with a lot of people, which you shouldn't, of course, this year, you should focus on protein: meat, fish, cheese, eggs, mushrooms, legumes also, and dairy. So focus on a larger amount of intake, of protein intake. And also, put everything in one plate. Do not use 3 different plates. And of course, do not build a huge construction of food. I think it will be beneficial for you, and you will not have ruined your weight after the holiday season. Thank you. Another question for Mr. Gargalianos. We have a lot of questions about vaccines. When are we expecting the vaccination to begin in our country? And do you know which vaccines will come to Greece? Of which company? And also, final question. Should we be afraid of the symptoms of the vaccine? And finally, if a huge number of the population is vaccinated, when will we be able to feel safe? How long do we need to go back to a relative, let's say, normality? These are all very good questions. First of all, vaccination in our country, if everything goes well, will happen at the end of January. The vaccine that we will have in Greece has been ordered by the government by Pfizer, the one that is used right now at the UK, Moderna and AstraZeneca as well. So we're going to have 3 types of vaccines. You need 2 doses of the vaccine, and 21 days must elapse between these 2 doses, and then we need another 10 days to have the antibodies. So we need about a month and a half from the moment we have the first dose until the moment we say that we are safe and that we have antibodies. Now, furthermore, it is important to see how many people will be vaccinated. In order to have more than 70% of the population must be vaccinated, because the virus has a huge mobility, as we know, in Greece and, of course, in other countries. And the last thing is what to expect. Well, what to expect? We should also expect the same things that we expect from other vaccines. Maybe a bit of a fever, low fever, or even high fever. Some itchiness in the place where we had the injection. Even some sore muscles. 60,000 people have been introduced in the phase 3 program.
Εμπαρόδο να πω ότι δεν απέχει πολύ από το σύνολο των ανθρώπων οι οποίοι εμβολιάστηκαν στη φάση 3 σε άλλα εμβόλια. Απλώς εδώ συμπιέστηκε ο χρόνος. Γιατί συμπιέστηκε ο χρόνος? Γιατί μιλάμε για πανδημία. 100 χρόνια είχαμε να δούμε πανδημία. Και δεύτερον, υπήρξε το alliance, η συνεργασία των φαρμακευτικών εταιριών με τα ακαδημαϊκά κέντρα και με τις κυβερνήσεις. Άρα λοιπόν έγινε αυτό γρήγορα. Περιμένουμε λοιπόν αυτά. Θα με ρωτήσετε, είσαι σίγουρος για τι θα γίνει μετά? Απότερες επιπλοκές. Θεωρητικά και πρακτικά ως έναν βαθμό το ξέρουμε, γιατί αυτή η πλατφόρμα εμβολίων δεν είναι τωρινή. Έχει ξεκινήσει εδώ και καιρό επ' άλλων κορονοϊών, όπως ο SARS και ο SARS-1 και ο MERS. Αυτοί οι οποίοι βεβαίως φύγανε γρήγορα, διότι έγιναν γρήγορες παρεμβάσεις και δεν πήραν χαρακτήρες πανδημίας. Άρα λοιπόν επιπλοκές δεν περιμένουμε μακροχρόνιες. Πάντως να ξέρετε ότι για κάθε φάρμακο και για κάθε εμβόλιο, όταν κυκλοφορεί, το παρακολουθούμε για πολύ μεγάλο διάστημα.
It is monitored when it comes into circulation for a lot of time. The UK, of course, is ahead of the game for about a couple of months, so we're going to have the data, their data, which are quite important. And also from the US, people that have volunteered to be vaccinated as a trial have already been vaccinated about 90 days ago, almost 3 months ago, and they did not have any serious side effects. This is very important. It is important for us to feel safer. So another question about this issue from one of our colleagues. If I get COVID and I get vaccinated at the same time, can something happen to me? No, it's nothing. We talked about this a lot of times. I have said that, I have talked about this in public. We've been asked that about measles, if you remember that. if I have measles or not, should I be vaccinated? The vaccinate boosts your immune system. Even if you have antibodies, if you have COVID-19 and you get vaccinated, it is just boosting your immune system. Nothing bad can happen to you. And from the moment that you are infected until the moment the test is positive, even 7 days might elapse. So during this time, you might be vaccinated. You are not aware of that. Thank you. Mrs. Argirakopoulou, another question for you. High-risk people can be considered as people with colitis or Crohn's disease. Vulnerable people are not only regarded as such because of their disease, but also because of the drugs they are taking. I mentioned people who are in immunosuppressant drugs, such as the people who have the Crohn's disease. Yes, they are people in vulnerable diseases. But we need to make sure that we should not stop taking our drugs, because this can be fatal. We never stop taking our drugs before consulting with our doctor. I have seen that in people, I have seen that in patients. Some of the drugs that are used in these immunosuppressive diseases have been studied in order to be used in COVID-19 as well. So please do not stop your medication unless you contact your doctor. And also, we do not also stop monitoring our diseases. I'm guessing that you've heard that in the news, that people with chronic diseases, and of course I have examples from my own patients with diabetes, avoid coming to the hospital or to my practice because they are afraid of COVID. But this can be fatal because of their own disease, because of their own underlying disease. This is a mistake. Thank you. Now, regarding the people without symptoms, can they transfer the virus? And what about children? If they are, how can we protect all the people in our household? Now, regarding the asymptomatic period, yes, the virus can be transmitted. Unfortunately, we have data, and they are very serious and important. Some people are super spreaders, let's say. Usually, more people will infect 1 or 2 others. Super spreaders will infect up to 10 more people. And in some cases, only 1 super spreader is needed for everyone to get sick. So, even asymptomatic patients will spread the disease. Symptomatic patients even more. Now, what about children? The data that we have explains that children are not easily infected below the age of 12 and do not also easily spread the disease. I'm not talking about teenagers, I'm talking about kids that are younger than 12 years old. In primary schools, for example, there were no cases at all, while in high schools there was a lot of cases. Even if the children in high school are older and can use masks and antiseptics. Right now we have a light lockdown here in Greece. The schools remained closed for this reason specifically. Now, what about your grandparents? It is much more likely to them to get infected when they are taking the children to school, because they will stay outside the school, chat with their friends. Of course, the children can transfer the disease. It's not common, so it is good for a specific period of time to separate the children from their grandparents. Very well. Now, about masks. There's a huge discussion regarding masks, and I would like to ask, what are the ones that we should use? The cotton masks, the medical masks? We are a bit confused. A cotton mask, if it has a high thread counts. And of course, when it's worn properly, if we wear the mask on our chin, it doesn't work. I have seen that in doctors even. We should wear the mask properly to cover the nose and the mouth. This is one thing. Also, do not touch it all the time. As Mr. Al Gore, we had on a video, he wore it, and you take it out of your ears as well. You do not touch it in the front. You touch also your hair, your eyes. No, this is dangerous. It should also be changed constantly. We should not keep the same cotton mask from morning to evening. We should change it a couple of times a day and also wash it at 60 degrees in the laundry machine. Now, about surgical masks, yes, they are protective. We use it in the hospital when we come in contact with confirmed cases. It's the same for them as well. If you wear it from the morning to the afternoon, the fact that you are wearing it and the condensation that is created by your breath and will make it moist. So it doesn't work. We should change it also a lot. I was talking about it with Mr. Sinolakis, a colleague of mine, and he said that the mask should be like a reflex. It should be worn all the time. It should be worn as it is worn in airplanes, for example. We should exit our home with the mask already in our face. Another thing that I forgot to say beforehand about vaccines is that in order to have the herd immunity, as we said, we should also continue to behave in the same way, to keep social distancing, to wear masks. Otherwise, the process will just stop, will be ruined. Another thing, let me just add that we should not feel safe with our close collaborators. Just the fact that you see someone every day, all day, this does not mean that it is safe for you to take off your mask, to have a cup of coffee with him, to have lunch with him, because we consider that we are safe with those people, but we are not, as Mr. Gargaliano said. You should wear your mask all the time. It is just for a short period of time. It will not be forever. Even with the people you are in close contact with. This is correct. Also, another question. What about blood types? Are there blood types that are huge, that have great percentages of getting COVID? A colleague of mine called me this morning and said that my son has COVID. I asked him, well, okay, don't be afraid. He's young, he's athletic. He's following the instructions of the doctors. He doesn't drink, he doesn't smoke. And he said, I'm really worried about my wife. But afterwards he said, I shouldn't be afraid of my wife because she is Korean and she has a specific blood type that is safer. No, you should not repeat that information. It is not true. So, a myth debunked right now. Another question. Something that can happen to all of us. Our relative, our husband, the person that we live in the house with. Let's say that he has COVID. How can we help him and how can we protect ourselves? First of all, he should be isolated in one room. We should give him food and drink only by wearing masks, both of us, of course. And of course, he needs to stay in there for 10 days, just to make sure that the disease has proceeded. He should, of course, remain at home. Yes, it is problematic, I know. It is quite difficult. If you have a huge mansion, it's easier, of course, to find a place to be isolated. Yes, you will lock yourself up in your 27th room or something. But If you're in a small apartment, you should take care that this person that has COVID should be isolated in one room, both wearing masks, of course. He should also have a window or a balcony to air the room constantly. And when he goes to the toilet, of course, when he uses the toilet should be cleaned afterwards immediately. It works. It can work, of course. It's not absolute. It's difficult. I wish everyone had 27 rooms to get isolated in. That's the way it is. Another question regarding the time of the year right now. It's time for New Year's resolutions right now. You're in hospitals right now, both of you. How can we schedule a regular checkup? Should we avoid coming to hospital? Now, regarding your regular checkups, yes, they can be postponed. It is not necessary to go for a regular checkup in January or right now in December because lockdown is still in full force. For people who are sick or who have underlying diseases, no, they should do their checkups. When we're talking about healthy people who just want to do a checkup for preemptive measures, yes, they can be postponed. Excellent. Now, regarding antiseptics, a lot of people all the time tend to use antiseptic instead of washing their hands. Is it the same? Only under the condition that they wash the hands for 20 seconds. In children, we ask them to sing a little song, the happy birthday to you, let's say, which lasts for more than 20 seconds. So they do their movements, they wash their hands, and they sing their song at the same time. First thing I had done to an elementary school, I was impressed, actually, because 100% of the students complied with my instructions. Water with soap is enough. Antiseptic is used at the hospital, of course, or when you're outside and you do not have a sink. So you have your antiseptic in your pocket, such as the doctor has it, or a nurse has it in their pocket. People can use it when they go to the supermarket or when they exit the supermarket. They have it in their car. It's the same thing, because the virus has a coating that it is demolished by soap or antiseptics. And also another thing, let me repeat that. The antiseptic needs to be a 70% pure alcohol. Only 70% and more pure alcohol. Mrs. Argirakopoulou, another question. The Prime Minister said a few days ago that we will spend the New Year's Eve with another family. Up to 9 people can be together in one house. How can we operate in this case? Of course, we need to have the windows open. It is helpful to ventilate, to air the room all the time. This is the guideline of the Prime Minister. In my opinion, we should stay at home. We should not be with other people, even if we have to. It is extremely important to air the room, to have good ventilation. It has been mentioned several times, and also constant ventilation, to keep the windows open all the time for the air to circulate. Now, it is not a shame, of course, to ask the people who are coming to our house if they have symptoms, if they are carriers, let's say, or if they are a vulnerable group. It is not a shame to ask the people that you have invited or the people to whose house you've been invited to. There's nothing else you can do, of course. When we're all standing around the table, which is very small, we cannot do anything to avoid the transfer. Well, if we have a huge mansion, as Mr. Gargaliano said, yes, it would be easier. Of course, no kissing, no hugging, no handshaking. These are sine qua non, let's say, when we are in the same space. But be aware that when you have people close to you, the danger of catching the disease is even more. Maybe handshaking should be forgotten in our huge in our lives. Oh yes, we can use the practices of Asian countries where they do not shake hands. We have found new ways, of course, of shaking, let's say, hands, the elbow bumps, because handshaking appeared in the Greek history later on. Ancient Greeks had different types of handshaking, let's say. So we have covered most of the questions of people who are observing right now. Would you like to add a last comment or give us any extra information? I would just like to say, first of all, I was impressed by the number of the questions, and they were also very smart. Congratulations. One more thing, use your common sense. And of course, you should know that nobody is indestructible. And also, I'm hoping that in 2021 we will be able to emerge with our health intact. Please be patient. Those 9 people that were said by the Prime Minister is up to 9 people to be at your home. Mrs. Argirakopoulou said something even better. Stay at home. It's just food. I mean, next year we will be together, healthy, and share food again. Thank you for your attention, and thank you for your interesting questions. I will agree with Mr. Gargalianos. Thank you. Thank you for the invite. It's good to be able to share our knowledge. I will advise you to send the text message with 6 and go outside and take a walk. Build a routine, eat well, and use this period of time as a New Year resolution, let's say. Let's say that it's a good time to introduce a new need in your life, and this need is exercise. Use this period of time to exercise and introduce a new habit in your life, and forget about hugging. We will hug each other in Easter, maybe even in the summertime, in order to be safe. Thank you very much for being with us today. First of all, we show our respect because you spend your entire day in a hospital. You put yourselves in danger all the time. So, happy holidays. All of us that are watching right now, we feel grateful. We feel gratitude for you being here with us today, and we will take advantage, let's say, of this relationship, and maybe after holidays we will have another discussion. Happy Christmas to all of you, and good night.